I gave an update of the most recent data about therapy with interferon in polycythemia vera. And in fact, we have now quite nice and mature results about the use of interferon in both high-risk and also low-risk patients with PV. In high-risk patients, we have the PROUD and continuation PV study that compared head-to-head Ropeginterferon alpha 2B to hydroxyurea. And we have published now the data after the last patient finished its 6th year of follow-up. So for a median of about 7.5 years for the whole cohort of patients. And we showed that interferon was superior to conventional therapy for inducing complete hematological response, to get rid of phlebotomies, but also to achieve molecular responses. And this molecular monitoring is probably useful because we also showed in a cohort of patients, retrospective, of course, in Saint-Louis, that indeed, when you were able to reduce the mutant allele burden below a certain threshold, that was in our study less than 10%, it was may be associated with a chance to achieve treatment-free remission in the patients with PV. So it could be interesting to follow the JAK2-VF allele burden, at least during a treatment like interferon alpha. Professor Babu, he also showed the results of the low PV study, an Italian study that compared the conventional therapy for low-risk patients with PV, that is phlebotomy plus aspirin, to the same treatment plus a low fixed dose of Ropeginterferon alpha 2B again. That was 100 micrograms every 2 weeks, when the usual dose is somewhere between 250 and 400 micrograms every 2 weeks. And what they showed in that study is that the addition of this low dose of Ropeginterferon to the conventional treatment was able to reduce, to maintain the hematocrit below 45% over time, to reduce the progression of the disease, because, for example, 8 patients had disease progression, all of them in the control arm versus none in the Ropeg arm. In addition, they also showed a reduction of the JAK2 mutant allele burden after 2 years in the study, confirming that it's useful to follow this burden in patients with PV treated with interferon alpha.